Hi, Dr. Rosenberg again. Today we're going to talk about low back pain, probably the #1 health issue facing this country, now costing billions of dollars in both medical fees as well as time lost from work and productivity. The problem with the back is it's a very complicated anatomical problem, because there are lots of things in the back that can cause pain. If you start with the center, you have your spinal cord, you have your nerve roots that come out of the spinal cord. The nerve roots can be pinched in this little foraminal opening that the nerve root comes out of. Then you have your infamous discs. The discs can bulge and rupture. And if they bulge and rupture posterior laterally, or out to the back and the side, they may pinch the nerve. Then you have joints that hold the whole column together. They're known as facet joints. And just like an elbow joint or a knee joint, a joint can become inflamed and cause pain. Sitting on top of the joint, you have the fine tendons and muscles that overlay this, and you can have muscle or tendon pain. And then finally you have the large overlaying back muscles or neck muscles, depending on which part of the spine you're at. The point being, you can have big muscle pain. The point I'm trying to make is, not all pain is disc. And that's what I'm afraid the surgeons sometimes forget. Because you can get an MRI and you can have a big disc, and you can take that disc out and you may still have pain. Because the joint pain, or the nerve root pain, or the muscle pain wasn't addressed. Our approach, the non-surgical approach, when you present with pain and a positive MRI with a big disc, is, well, I can't change the disc very much, although there's some treatments I can use to improve it. Some medications can improve it. Some traction can improve it. Sometimes a manipulation can improve it, depending on what kind of disc you have and where. But more importantly, while I may not be able to improve the disc pain 100%, I probably can improve the joint pain and the nerve root pain and the muscle pain and the disc pain 10%. Well, now you have 4 or 5 things I've improved 10%. Suddenly you are feeling 50% better, which is a huge step for most back patients. The idea being, we try to treat the problem as best we can without surgery before making surgical decisions about your back. And that's what we're all about.